Interprofessional learning can be defined as occasions when two or more professions learn from and about each other to improve collaboration and the quality of care.
Interprofessional learning promotes collaboration through professions working together, learning from others, supporting colleagues, and ultimately enhancing the quality of care provided.
It improves planning and coordination of personalised care for patients. It allows practitioners to share specialist knowledge and skills with learners and reflect on their own practice and development.
It improves quality of care, focuses on the needs of service users and carers, encourages professions to learn with, from and about each other, respects the integrity and contribution of each profession, enhances practice within professions, increases professional satisfaction. We got in touch with Claire Kane from the University of Bedfordshire to discuss her personal experience of interprofessional learning and how she was nominated for an RCN award in recognition of the highest standard of teaching. Claire Kane talks about how she set up a clinical anatomy teaching course alongside Dr. David Bailey, consultant pathologist at the NHS Trust, which is open to final year Bedfordshire students on placement at Buckinghamshire NHS Trust. Here is what she had to say.
Well, I've been running clinical anatomy teaching sessions the last year for final placement student nurses. This was in response to, we had an issue with student nurses going to theatre, going to watch autopsies because they weren't being supported there, and some were having less than positive experiences. So what I did was I got together with David Bailey, who's the consultant pathologist in the Trust, and we looked at how we could do this interprofessional working, so working together, so that's the hospital trust and the universities, that's him and me if you like, to support structured learning for student nurses. So we did this, and the education department in the Trust, this is Gemma Brown who's now left, actually nominated us for the Student Nursing Times Award. Now, to do that, it had to be endorsed by 3 student nurses. So 3 student nurses wrote this really lovely glowing report about how fantastic the clinical anatomy was and how at the end of the course it actually just knitted everything together. So things that they'd learnt on the ward they then see in gross anatomy, and they can link all their learning together. So things from the books make sense when you're holding a piece of anatomy and you think, yes, this is how it works. So in the end they had to have 20 student nurses who had been through the programme who had to fill in a questionnaire. So that's how we were nominated. Well, what I said really, I have Dr. David Bailey, consultant pathologist. He's also education lead at the Royal College of Pathologists. So he's very involved in education, but education mainly for medical, for his, for pathologists, so student pathologists if you like, and medical students that come from Oxford. He's never been involved with student nurses before, but actually has said that he gets an awful lot of pleasure, if you like, from teaching student nurses because they want to learn. And they also ask lots of intelligent questions. And the other thing that we did together is that we wrote a workbook for the student nurses to complete. So that was an interprofessional working. We put that together. Feedback I've had from the student nurses, we're quite lucky with the first lot because some of them had actually gone on an ad hoc basis and just rung up the mortuary and said, oh, can we come down? And they've been down, and some of them hadn't had a very good experience. Some of those ones decided never to come down again, but some of them said, yes, we want to come down because the way I do it is I support them. So we talk about it beforehand, we go down together, I always go with them, I stay with them, then we have a reflective time afterwards, so we have a debrief. So I always tell student nurses to bring money for coffee and cake, because it was going to be expensive, because I was having to buy everyone coffee and cake afterwards. Sit down, we talk about it, we debrief, and then they write a reflection afterwards. They were saying that they could compare the two times, so the time when they came down they were unsupported and the time that they were supported, and they said the difference was amazing, that they really got something out of it on an academic level rather than just a look at, you know, gross anatomy.